Okay, we'll go ahead and get going. So thanks for joining us today for It's Worth a Shot. We're going to be covering two topics today. The first is emerging strategies to address the opioid epidemic. And the second is getting smart goals for success. I'm sorry, setting smart goals for success. Next slide, please. We do want to let you know that sometimes we have outside presenters, third party, if you want to call them that. We just wanted to make sure everybody knows that that doesn't mean that we endorse or recommend those viewpoints. We just like to make sure that we share the most information that we possibly can on this webinar. The presenters today are actually Mountain Pacific employees. Next slide, please. So we want to give you a couple updates. The other, last week we did a presentation on Vivint Health education program. We have a flyer here for you guys to look at if you want to, or you can go to the link. And so this is the interactive learning that we showcased last week. Also, we wanted to let you know that February is Heart Healthy Month. And so if you want to look up some information on that, we have a CDC link there for you. And then we also wanted to remind you guys that we do have a series called Q&A with Dr. K. And we just linked a couple places of where you can actually pull up that podcast to listen to. But it's kind of fun to see the different topics that our in-house Dr. K covers. And yeah, we just wanted to highlight that to remind you guys that that is a series that's ongoing. Next slide, please. As always, we do appreciate when you guys write in topics for us to cover, and we also appreciate you guys joining us every Wednesday. So in the evaluation that Mary will put in the chat, please fill that out, and then there's a portion where you can write in any kind of topic that you would like to share with us or have us cover or anything like that. Can we load the polling question, Mary? So as discussed, last year last week, we went over Vivint Health. So we were just curious of how many of you plan to implement Vivint Health. And if that's a no, do you need any further information about the learning module? Okay, looks like it's mostly a no. So thanks for that feedback. We can go ahead and end the poll, Mary. And we'll go to the next slide. All right, for our weekly influenza snapshot. Most of our states are in the clear with a minimal amount of flu cases, but as you can see, we have Wyoming, who is bright red. And so they're still in the very high. So let's hope that that continues to go down. Looks like most of the trends we have are either decreasing or remaining the same. Let's go ahead and go to the next slide. And for our weekly COVID snapshot. So we're having a decreasing trend again on COVID positive cases, hospitalizations, and deaths, which is, well, deaths is kind of borderline, but that's great. And if you look at our areas, we're mostly green. We have a couple red spots, you know, that a substantial increase, but I mean, I think that's just gonna be par for the course for us now. Next slide. All right, I'm gonna hand it over to Amber Rogers, who's gonna be talking about some emerging strategies to address the opioid epidemic. Amber, go ahead. You're on mute if you're talking.
Just yes, I was not quick enough with the button. You would think after all these years, one would figure that out, but no. So Amber Rogers, I live and reside in Missoula, Montana. So most of what I'm going to talk about is a direct result of the work that we do within Missoula. But I also have connections and attend lots of coalition meetings across the state of Montana. And so some of these strategies about addressing the opioid epidemic are statewide interventions, as well as other local interventions that we have across the state. So just a couple of shout outs about opioids. Of course, you've all heard about the opioid epidemic, and it is not slowing down. I did not include a graph of all of the lives that have been lost due to opioids, But one thing to know is that opioids are not a standalone condition. People that have perished due to opioids, they also have other substances usually in their systems as well, including meth. Xylazine, which is a veterinary opioid, are also in our drug supply in Montana. And you know, nothing is a standalone drug anymore. So there's lots of cross poly substance use. Next slide. Some of the things that local coalitions are doing, if you are interested in addressing substance use disorder in your community, there is likely a coalition that is already doing the work in your community. These are just some of the ones that I am aware of. And you can probably just reach out to your local public health department, and they can probably point you in the right direction. These are just the ones that I am aware of. So I highly encourage you or family members to become involved, because this is an all-person affair that we all need to be involved. Stigma is one of the one area that we can all become more attuned to, more than anything. People have a lot of preconceptions about people that use drugs. These are our family members. These are our loved ones, and we can't be in recovery from the issue of substance use disorder if we're dead. So we have to get people past the point of using substances on a consistent basis so that we can get them to recovery and have them become productive members of our society. And that recovery is possible. Next slide. So this is the vision and mission of our our drug safety coalition in Missoula. And so you can see a lot of what we were really trying to get at when we talk about our vision of recovery and safety, that every single member of our community's life matters. We want to have safety. We want to have people be healthy, and that improves the life for all of us. We don't want to see people using on the streets. We don't want to see people homeless, and we don't want to see people, perhaps having psychotic breakdowns and things like that. So, our mission really is to impact the culture and the policies, so that we reduce the chance that people have barriers to care. And then ultimately, when we intervene earlier, we decrease the cost of care, we decrease the risk of incarceration, and we increase the chance that people live productive and have full employment. So those are some of our lofty goals in our Missoula Drug Safety Coalition. Next slide. So key partnerships, this is like huge when you're dealing with a coalition, and every coalition has different membership, and just don't turn anyone away. The reason why I highlight the people with lived experience is those folks are key to make sure that you are always centering the person with lived experience in your work, because you can have all kinds of high-minded ideas about what you're trying to accomplish, but if you are not including those voices of people that have been there, lived that experience, you're kind of missing the boat. The advocacy portion of what you're doing in substance use disorder is important. Law enforcement is also key. We unfortunately have lost our law enforcement representative in our coalition, and we're actively trying to seek that out. So a couple of key things that we do for interventions: Open Aid Alliance They are great. They do our syringe pickup. They do all kinds of syringe exchange programs. Partnership Health Center does a ton of work with our homeless population. The University of Montana, they do a lot of naloxone education along with our public health folks. Tons of naloxone distribution. United Way does our workplace recovery friendly stuff. Okay, I could just go on. I'm not gonna go on because I only got a few minutes. Next slide. Oh, yeah, so this is the slide that talks about all that stuff. One of the other things that's super exciting that we're doing in Missoula is we have BioBot wastewater surveillance. So these folks came to us. This is a federal program. So our wastewater, much like COVID, our wastewater was surveyed to test COVID levels in our sewer systems. Our wastewater is being surveyed in Missoula for drug levels. So not only all of the opioids, but also methamphetamine, xylazine, all the fentanyl byproducts as well. And naloxone levels, so we can see how much naloxone is getting out in the system. So we'll be able to track how much drug use is out there. And all of those other programs that I mentioned on the slide that you can see on the slide, those are all things that our Drug Safety Coalition are involved in. So yeah, so we do a lot. We do a lot of stuff in our community. Next slide. And then this is our fancy, we don't have them yet. They're on back order. But this is our naloxone vending machine. We are going to have 4 of them in our community. These big ones are going to be right at our transit station, our bus station. And so they're going to have all these doses of naloxone, and it's going to be called Doses of Hope. And a lovely pharmacy student named it. He came to one meeting and he's like, why don't you just call it Doses of Hope? And we're like, God, you're brilliant. These youngins, they know everything. And I think I saw a question. Did I see a question?
Yep. You sure did. It says, do you know the percentage of community individuals that have purchased Narcan and have in their personal first aid supplies?
I do not know how many have purchased it. We have such a large distribution program because between Open Aid and the Public Health Department, that we pass out a lot of naloxone. So I don't know.
They want to know if it's, sorry, Amber, and they also want to know, is it available online?
It is available online, and the distribution center for all of Montana is Open Aid. And so if you go to nextdistro.com, and I'll put that in chat, if I can figure out where that is. And you are in Montana, you will receive that free of charge from Open Aid Alliance. Their funding is somewhat in jeopardy from the state. So call your Congress people if you're from Montana and tell them that you want to fund Open Aid in Missoula, Montana, so that they continue to send out free Narcan to everybody.
Yep.
So next. And Next Distro is also in Alaska. I don't believe Wyoming has access to it because of Wyoming.
Kyla did pop in the chat the website you can get free naloxone in Alaska.
Awesome.
All right, we'll pass it over to Crystal now for setting SMART goals for success.
Hi, everyone. Can you hear me okay?
Sure can.
Okay, great. All right. Well, thanks for having me. And yes, I'm here to talk to you all about setting your SMART goals. And today I'm going to, since we have some clinical and some non-clinical folks, I'm trying to make it interactive as possible. So I'm going to focus on health and wellness today. So if you have used SMART goals, I want to hear from you either in the chat or give me a thumbs up. And Mary, while they're doing that, can you go to the next slide? Okay, so I'm not seeing anyone with a thumbs up or anyone in the chat with the SMART goals, or they have done establish a SMART goal. So hopefully this is going to be a good presentation for you all. So implementing SMART goals is an easy way to keep your projects moving forward. It helps with accountability, the timing, and overall tracking of your accomplishments. Okay, thank you, Ben. So first, you should, but by developing a SMART goal, you should ask yourself the 5 W's. So what is the problem? What do you want to accomplish? And by how much? Why it's important, and why is it important to you, the team, and the organization? And for who? So who's going to be involved? Who is this intended to help? Will this take place? Where does it begin and where does it end? What is going to be involved? And what are the limitations and barriers? So we always see those when we're setting SMART goals, and we always run into that. And how are we going to get there? So the 5 W's, remember that when you're developing your SMART goals. Okay, next slide, please. So I want to share a quote with from Dr. Donald Berwick. He's a pediatrician and co-founder from the Institute of Healthcare Improvement. And he says healthcare must be organized according to the practical wisdom of those actively doing the work. So highlighting that, it does take a team and no one should bear the burden of trying to figure out a problem on their own. But most importantly, don't forget to include those that are actively doing the work. So if you are trying to implement quality improvement within your organization around your environmental services, it's vital that you have someone from your environmental service team on your SMART committee, making sure, because they are the ones that are actively doing the work and most likely have some answers that can help you solve your problem. Okay, go ahead to the next slide, please. So I'm going to bring in, I guess, this is a SMART goal that I worked on to develop myself, and I'm going to recruit all 62 of you to help me attain my goal. So my specific problem that I'm stating here is that I am at increased risk of developing kyphosis. So those of you who are not aware with what kyphosis is, it's a curvature of your spine, and it's your posture. It affects your posture and gives you, I guess, a hunchback look. And it's common in aging women and those with osteoporosis. So my goal that I've established for myself is I want to get stronger. So is this goal specific? Did it answer the 5 W's that I just explained to you all?
Yes.
The answer is no. So instead, I will want to say I will complete 60 minutes of power weight training classes 2 to 3 times each week for the next 3 months, increasing my bar weight by 10%. So did that answer the 5 W's?
Yes, definitely more succinctly that time.
There you go. That very good. So thank you very much. So we can go to the next slide. Okay, so now we've developed our specific goal. So now how are you going to help me measure my progress and make sure that I am staying on track? So I've come up with a few here. I'm going to develop a checklist so I can make sure that I'm doing my 3 days a week, and I'm going to track it weekly. So I'm going to make sure that I'm not falling down on the job and that I'm doing what I said I was going to do. I'm going to use artificial intelligence, such as my Apple Watch or my phone applications, is going to show me when and by how much I'm increasing my bar weight. And then I'm going to try to recruit a workout partner to make me accountable. So giving my list here, meaning that I want to make sure that I get to these classes the 2 to 3 days a week. I want to increase my bar weight and I want to do it within the next 3 months. Is there anything else that any of you on the line today could suggest to me to make sure that I meet my goal that I haven't thought of in my checklist? Okay, so I've got a couple of answers. So before and after pictures of progression for improvement. Perfect. Thank you, Ben. So you need to really, for me to be able to make sure that I am progressing, pictures would be perfect. Before and afters. Schedule a time at the gym. Yes, good. Reward myself for success. Reward programs. Excellent. Yes. So a good reward program for me was if I meet this goal, I'm going to buy that purse or pair of shoes I was eyeing. So that would be wonderful. That's good motivation for me. Baseline weight. Yep. Very good. And then the other thing that I'd like to mention here is that I want to make sure that this is displayed somewhere. So when you develop your SMART goals, the team wants to know that they're progressing. So kind of show maybe like graphs, pie charts, something to show that, oh my gosh, we're meeting our goal, it's working. So thank you all for your commitment to that, to helping me make my goal. Okay, so go ahead and if you want to advance to the next slide. Okay, so now is it achievable? So we're on the A. So how am I going to, I want to make sure that it's that we measure this quantifiably so we can track your progress. So I need to ask myself, is this achievable? Do I have the skills to make this successful? And who am I going to need the support of to make sure that I can get to the gym on time, make sure I get there to achieve my goal? So here's my scenario. So I do have the gym membership. And the gym membership has the power class that I need to go to 7 days a week. So Monday through Friday, it's 6 a.m., noon, and 5:30. Saturday and Sunday, they offer it at 10 o'clock in the morning. So my work schedule is I work from 7 to 5, Monday through Friday. My husband's work schedule is 7 to 6, Monday through Friday. I do have 2 teenage children, 13 and 16. So one drives, go to different schools. They are they do have after school activities, sports and clubs, and I am the primary caregiver. So I do make sure that dinner is on the table at night. I take off of work to go if I have a sick child to take to the doctor, or if they have a school conference or coaches meeting that I need to go to. I'm the primary caregiver for that. My preference would be to make it to the 5:30 class in the evening. Noon is out of the question. And depending on how I sleep the night before, 5 p.m. or 5 a.m. is awfully early for me. So I'm in, again, recruit all 62 of you to help me. How can I gain the skills to be sure that I get to this class, preferably at 5:30 in the evenings, to make my goal? Does anyone have any suggestions for me? Have you thought about meal prep? Oh my gosh. Has anyone heard of HelloFresh? Anyone used it? I love HelloFresh. So what HelloFresh is it is meal prep. And so it delivers straight to your door. And so Ben, thank you for that life changing idea. I love it. So when you have meals delivered and prepped for you, that solves the issue of me making dinner. Delegate, yes. Task to your family. So I'm going to ask my husband, hey, I have so-and-so that needs to get to the doctor today. I need to make sure that I get to this workout class. Are you able to schedule out time for your day? So excellent. Teach 16, yep, some cooking skills and utilize crock-pot recipes. Excellent. Yes, so as you can see, I'm not bearing the burden of this alone. I'm recruiting the help of my family to meet these goals. If I can show my progression of my checklist on the refrigerator so my family can see, oh my gosh, mom's making it, and I'm so proud of her, they are going to be more inclined to help me meet my goal. Let's see, did I miss anybody here? Have teens do, yes, home tat, yes. There's no reason why my kids can't help around the house more. And you know what? It's shame on me for not asking for help. So thank you all. Go ahead to the next slide, please. So again, we're on the R. So is this relevant to what I'm trying to achieve? And how can I, again, what's the motivation for this goal? Well, the motivation for this goal is that I don't want to have kyphosis. And I want to make sure that I'm sure all of you are now sitting up straight, either standing or in your chair, because strength training, its research proves that it does improve posture, stability, your bone density, metabolism, cardiovascular health, but most of all, it's going to improve mood and mental health, which is really important for work-life balance. So yes, it's relevant. Mary, do you want to go to the next slide, please? And then is it time bound? So I think, yeah, is it time bound? So with all the options that you all have put forward for me today to help me with my goal, do you all think that if I start doing meal prep, delegating more tasks to my family to get to this workout class on time and 3 days a week, do you think it's realistic for me to start March 1st? Yes, big yes. Yes, okay. Yes, okay. And yes, you can have to plan ahead and start accordingly. So perfect. Yes, I think it is realistically for me to arrange for meals, maybe even carpooling for my 13-year-old, maybe, you know, again, sitting down my family and just saying, I need all of you to maybe help around here more to give me 3 extra hours so I can get to the gym so I can meet my goal. And then do you think that using the checklists and the before and afters and everything else that we talked about, that the deadline, I can meet my goal by the deadline of June the 1st of 2024? Yes. Okay. Thank you, Denise. I think so. And so that, folks, I think that is the last of my presentation, and that is how you develop a SMART goal. So I hope that helped you today. Please reach out to your account manager. It's not intimidating as it does look. Here are some resources that you can look at. Mountain Pacific has some quality improvement basics, and I also recommend IHI. And Miranda, that's all that I have today. I'll swing it back to you.
Okay, great. Does anybody have any questions for Amber or Crystal today? If you want to come off of mute or if you want to pop them in chat. All right, doesn't look like it or sound like it. We can go to the next slide, Mary. So I want to thank both Amber and Crystal for taking time out and presenting on It's Worth a Shot today. Really appreciate you stepping in for us. I also want to remind you guys that there is an evaluation in chat. If you can please fill that out. We really do appreciate the results that we get from there. And then I also want to let you know that next IWAS will be on Valentine's Day, February 14th. And we will be discussing Heart Healthy Month kickoff, even though it is the second week of February, but that's okay. And then we'll also be talking about adverse drug events and a tool that's associated with that. So again, thank you to Crystal and Amber, and thank you all for participating in It's Worth a Shot this week. And we will see you back next week, hopefully.